Winner on topic laboratory diagnosis of diabetes mellitus. Objectives. By the end of this presentation, participants will be able to describe role of laboratory in management of diabetes mellitus. Collect and properly manage samples for glucose measurement. Introduction. Diabetes. What is diabetes? Diabetes is a group of metabolic disorders sharing common features of hyperglycemia. What are etiology or causes of diabetes? They are impaired insulin secretion, impaired insulin function. Role of laboratory. That is diagnosis, screening, assessment of glycemic control, assessment of association of long-term risk. Laboratory tests. What are laboratory tests done for diagnosis of diabetes mellitus? They are urine analysis, blood chemistry, immunological assays. In under urine analysis, we measure glucose level, ketones level, microalbuminuria, blood glucose chemistry, blood glucose estimation, glycated hemoglobin measurement, that is HbA1c, lipid profile, immunological assess, sample collection. There are two water samples that are collected for laboratory tests. There are 3 to 4 ml of venous fluid. Their samples are collected in sample collection tubes, that is in combination of sodium fluoride, EDTA, plain red top. Early morning urine samples. Sample management. Whole blood at room temperature, sodium chloride, leukocytosis and bacterial contamination, glycolysis at 7 milligram per deciliter per hour. Laboratory test for diagnosis. Estimation of for laboratory tests, to do estimation of blood glucose. It is fasting blood glucose, post meal or post prandial blood glucose, random blood glucose. Fasting blood glucose level measured before taking any meal or eternal overnight fast. Post meal or post prandial blood glucose, the glucose level measured 2 hours after the subject has taken a normal meal. Random blood glucose is measured at any time of day. Oral glucose tolerance test. Glucose tolerance test. What is glucose tolerance? Glucose tolerance means ability of the body to utilize glucose in blood circulation. What are indications of glucose tolerance test? In asymptomatic persons with sustained or transient glycosuria. In persons with symptoms of diabetes but no glycosuria or hyperglycemia. Persons with family history but no symptoms or positive blood findings. In persons with or without symptoms of diabetes mellitus showing one normal blood finding. In patients with neuropathies or retinopathies of unknown origin. Contraindications of glucose tolerance. There is no indication for doing DTT in a person with confirmed diabetes mellitus. DTT has no role in follow-up of diabetics, that is, should not be done in ill patients. Types of DTT. Standard oral glucose tolerance test, IV glucose tolerance test, preparation of patient. How do you prepare patient for any laboratory? Patient should be on carbohydrate-rich unrestricted diet for 3 days. Patient should be ambulatory with normal physical activity. Medication should be discontinued on day of testing. Exercise, smoking, and tea or coffee are not allowed during test period. OGTT carried out in the morning. The patient is fasted overnight for 8 to 14 hours. Test. If fasting venous blood sample is collected in the morning. Patients ingest 75 gram of anhydrous glucose in 250 to 300 ml of water over 5 minutes. For children, the dose is 1.75 gram of glucose per kg. First, in classical procedures, the blood and urine samples are collected at half-hourly interval the next 3 hours. A curve is plotted with the blood glucose levels on the vertical axis against the time of collection on horizontal axis. The curve so obtained is called glucose tolerance curve, normal glucose tolerance curve. Diabetic curve. This is diabetic curve intravenous glucose tolerance test. This test is undertaken for patients with malabsorption, that is celiac disease or enteropathies. Under these conditions, oral glucose load is not well observed, and the results of oral glucose tolerance test become inconclusive. IV glucose tolerance test procedure. IV glucose tolerance test is carried out by giving 25 grams of glucose dissolved in 100 ml distilled water as intravenous injection within 5 minutes. Completion of infusion is taken as time zero. Blood samples are taken at 10 minutes intervals for next hour. The peak value is reached within a few minutes. IV glucose tolerance test interpretation. Normally, blood glucose level returns to normal range in 16 minutes. In diabetes mellitus, this decline is slow. Laboratory tests for screening. What are laboratory tests for screening? Recommended screening test is mainly fasting plasma glucose. American Diabetes Association recommends screening for type 2 diabetes mellitus in all asymptomatic individuals greater than or equal to 45 years of age using fasting plasma glucose. If fasting test is normal, screening test should be repeated every 3 years. If fasting blood glucose level is normal, but there is strong clinical suspicion, then oral glucose tolerance test. Selective screening. High risk individuals, obese, persons with obese, or person with family history of diabetes mellitus, person with hypertension, dyslipidemia, impaired glucose tolerance. Screening test is performed at earlier age, that is, at about 30 years, and repeated more frequently. Laboratory test to assess glycemic control, like periodic measurement of glycated hemoglobin, daily self-assessment of blood glucose, glycated hemoglobin, high it is HbA1c. Glycated hemoglobin is HbA1c gives information about average blood glucose concentration over a retrospective period of time. Reflects the mean glucose concentration. Normally less than 5% of hemoglobin is glycated. More informative. Blood sample can be drawn at any time of day. HbA1c of 6% corresponds to mean serum glucose level of 135 mg per deciliter. With every rise of 1%, serum glucose increases by 35 milligram per deciliter. If 1% is increased, then serum glucose is increased by 35 milligram per deciliter. Urine glucose estimation. Presence of chemically detectable amount of glucose in urine is called glycosuria. Urine glucose test results correlate well with plasma or serum glucose values. The presence of glucose in urine indicates that blood glucose level of patient could have elevated greater than 180 milligram per deciliter. If a blood glucose level is elevated more than 180 milligram per deciliter, then glucose is present in urine. Normally less than 500 milligram per 24 hours or less than 15 milligram per deciliter of glucose is present in urine. Laboratory tests for assess long-term risks. Urinary albumin excretion, lipid profile, proteinuria. Urine should be screened for proteinuria with conventional dipstick on an early morning urine specimen. If urine dipstick for proteinuria is negative, screening for microalbuminuria should be performed. If microalbuminuria is detected, confirmation should be made with two further tests within 3 to 6 month period. Lipid profile, triglycerides. Triglycerides is less than 150 milligram per deciliter, then the person is at low risk. If Triglycerides is at 150 to 199 milligram per deciliter. A person is at comes under intermediate risk. If triglycerides level is greater than or equal to 200 milligram per deciliter, then person is at high risk. Low density lipoprotein cholesterol. The LDL cholesterol is less than 100 milligram per deciliter, then person comes under dietary low risk. If LDL cholesterol level is 100 to 130 or 100 to 129 milligram per deciliter, then he comes under intermediate risk. If LDL cholesterol is greater than or equal to 130 milligram per deciliter, then the person is at high risk. High density lipoprotein cholesterol. If HDL cholesterol is less than 35 milligram per deciliter, then person is at high risk. If HDL cholesterol level is 35 to 45 milligram per deciliter, then person is at intermediate risk. If HDL cholesterol is greater than 45 milligram per deciliter, then person is at low risk. This ends my topic seminar. Thank you.